Everyone. I'm Dr. Samina Ahmed, and today I have a special guest, a dermatologist. She's Dr. Jennifer Haley, and she has spared time to come and share some wonderful knowledge, information with all of you who've joined us. So it's an exciting day for us. And I want to introduce Dr. Jen Haley. She's a board certified dermatologist, over 20 years of experience in medical, cosmetic, and surgical dermatology, specializes in holistic specific skin health approaches, advisor to many startups and Fortune 500 companies. So she's a celebrity doctor, and she's also has her own podcast called Radiance Revealed. So welcome, welcome, welcome.
Thank you, Dr. Samina. I'm so happy to be here and share knowledge with everyone so they can be empowered to take care of their own health.
And it's so important, Dr. Haley, in these times to get the right knowledge and information, because now we are living in a world of social media where we are bombarded from all angles by knowledge. And, you kind of wonder what is right, what is wrong, who's telling the truth, what should I do? So when you get people with integrity who have the certifications, the knowledge, the qualification, it's always important, I think, to benefit from that. And we really appreciate that. So let's go to our topic of discussion today, which is the science behind wound healing and skin aging. So, interestingly, our product, Lamiderm Apex, which is the new one we have now, this is our new product. It's called the Advanced New Formula, and we will be talking off and on about it. But my intention today is to get a lot of knowledge from you about basic features of skincare and what is the science behind wound healing and skin aging. So I'm going to be focusing on that. And I do know that the wound healing, phenomena, or the science of that, and the skin aging, it actually is the same biological processes. And so the only problem is as we age, they slow down. So if we somehow had a way of reinforcing, helping these processes through different ways, we will be able to delay aging. We'll be able to get a beautiful skin, and it'll, last us a longer time. So let's move to the first slide. And I would ask, everybody on this webinar to start asking us questions. If you have anything you want to ask specifically from Dr. Jen, and you feel you are struggling, and remember, no question is a stupid question. So just go ahead and write and type, and we'll be addressing them during the webinar. So we'll start off with our first slide, which is mainly focusing on wound healing. And I would like Dr. Haley to explain it to us in the simplest way possible.
Absolutely. Yeah. So as your skin is healing from a wound, you can see my face, for example, I was burnt with a curling iron over the weekend during a podcast shoot, and I've been using Lamiderm on my face, and it's healing quite extraordinarily, by the way. So there's a number of processes that take place during wound healing. The first is hemostasis. That basically means that you stop bleeding. We always want bleeding to stop before there's any healing of the skin. The second is there's a little inflammatory phase because all of the fibroblasts, the macrophages, all of the important cells that are necessary to repair the wound need to be summoned to the area. So there's inflammation and there's messages that are sent to say, hey, we need your help here. And all of those cells are sent to the area and it looks inflamed. It might look a little red, for instance, and a scab might form. Personally, I do not like scabs to form because scabs are like a wall. And when there's a scab there, the edges of the skin can't quite come together and heal as evenly as if you had an area of moisture that would bathe the skin cells so they have a medium to grow on to come together. And then is the proliferative phase, and that's when the collagen is regrowing. So our normal collagen in our skin, if you grab your cheek or your hand, our normal collagen has primarily type 1 and type 4 collagen, but there's many types of collagen in there. And during wound healing, we have, or during a scar, we have a lower ratio of type 3 to type 1 collagen. And that's why scar tissue will look a little bit different than regular skin. We want to do everything that we can to minimize the appearance of the scar to help with the remodeling phase of the wound healing process. And this takes time. So it takes a scar a full year to form. So what will happen if you have fair skin is your skin will tend to have a pink area. So think about if you burn yourself or if you have a pimple or a scratch, you'll have a pink area there for 3 to 6 months. For those of us with medium or darker skin tones, I'm half Spanish, even though I look fair, I tend to get hyperpigmentation. So what happens in that type of wound healing is that the pigment cells are summoned during the inflammatory process, and they think there's a party going on. So they're going to the inflammatory process. And then as the wound heals, the pigment cells kind of stay around like an unwanted guest for 6 to even 9 months. So the more we can reduce the inflammation while uh, still proceeding with wound healing, we want to reduce the inflammation and initiate wound healing and support wound healing while minimizing inflammation using the right ingredients. That is going to give you the best looking scar with the least amount of unwanted side effects.
Thank you so much for that. And I'm so sorry to hear that you burned yourself with that curling iron. But I'm also happy to hear that Lamidum Apex is kind of, assisting that healing. And, we have collagen 1, 3, and 4 in this serum. And I know that a lot of serums which are in the market usually have collagen 1. So we have that extra boost of collagen there. And you talked about these beautiful processes here, all four. And I personally have a little story there. I mean, anytime I've had any injury or anything like, I don't know how many people have had chicken pox. But I did. And, so I'm somebody who always gets post inflammatory pigmentation. I'll bump myself against a wall and there'll be a discoloration. So I think, is it correct that there is a genetics behind it? Because my mother was also somebody who had post-inflammatory pigmentation constantly, whenever there was a problem.
Yes, that's an excellent question. So it's really based on how many melanocytes we have. And the melanocytes are our pigment cells that produce melanin. And then melanin, so melanocytes in our basal cell layer of our epidermis produce melanin, and that melanin is distributed to about 24 keratinocytes, which are the skin cells on the top layer of the surface. So anyone with more pigmentation on their skin will always be more likely to develop post-inflammatory hyperpigmentation, whereas those with very fair skin will have erythema or redness as a result of the scar. So there's really nothing you can do about how to determine whether you're going to be hyperpigmented or brown spot or pink or erythema. It's your genetics based off of that. The two things you can do is reduce the inflammation and avoid sun exposure. So when she burnt me with the curling iron, I just make sure that I have sunscreen on and my hair is covering the area because I will hyperpigment. But it's okay. I've seen it many times and it will go away.
Yes, and I think the skin regenerates, so that's the best part of it. And I also found out that we all have the same number of melanocytes. The only difference is that the skin tone effect is different. Like if I have a different color than yours, is based on the activity or activity level of the melanocytes. So if they are more active, then I have a darker tone, whereas the people who have more fair skin means their melanocytes are not that active. But I didn't know that we all have the same number of melanocytes. I've always thought that, okay, the people who are darker have, more melanin in their body and stuff like that. So that was an
Right.
interesting sort of discovery.
And there's different amounts of melanocytes in different areas of our body. So like the area around the genitals has more, they have more melanocytes in that area, and it's natural to be more pigmented there. So there's normal variations even throughout our body of melanocytes, but we all have the same number of melanocytes, and it's just how active they are. And if we're getting a tan, they're more active. If we're
Yeah.
living, if we have more pigment naturally in our skin, they're more active as well.
It's interesting, Dr. Haley, that I read that grass is always greener on the other side. So I have seen people who have straight hair, they always go for the curly. People who are fair want to tan. The ones who are dark want to become fair. It's such an interesting phenomena that never being satisfied with what we have. I hope and pray that we become more like that, being content. So let's move to the next slide.
This is the year of embracing authenticity.
I tell you exactly, and also of less is more, I guess, making it less complicated. And, I remember that saying by Confucius. I think he's the one who said, life is not complicated. It's us people who make it so.
That's one of my favorites as well.
Yeah. So let's talk a little about why does skin have to age? Why couldn't we have just stayed nice and youthful throughout?
This is one of my favorite topics. Okay, so when I was in medical school in the 90s, we were taught that your genetics determine pretty much everything. And now we're finding the field of epigenetics is quite powerful. So, somewhere around 85% of our lifestyle choices of our aging, the rate at which we age, is determined by outside forces. And there's quite a few studies looking at identical twins and how they age differently depending on their lifestyle. Do they smoke? How much UV radiation are they getting? What kind of foods do they eat? What are they doing for their skin? How much stress do they have? How much sleep do they have? All of these factors contribute to the rate at which we age. And there's even internal biological clock aging that can be tested to determine the rate of your cells. And we know that the skin represents all the organs in your body. So the rate at which your skin is aging is often correlated to internal, not always if you live somewhere sunny. But what's happening is every day with these outside influences, whether it's sugar from the diet, UV radiation, smoking, all the things I just mentioned, the collagen is deteriorating over time. And we tend to look at collagen loss because it's the most abundant protein in the dermis or the skin when you pinch it. And around perimenopause, which can run between 35 and 55, we start losing more and more collagen. And then once women hit menopause, in the first 5 years after menopause, without estrogen in our body, the amount of collagen can drop by 30%. And visibly to me, when I see this in the clinic, what it looks like is if you have a party and you have a bunch of balloons in your house and you clean them up, but then there was one balloon in the corner and you forgot about it, and you come back 2 weeks later and it's deflated and you have lots of little crinkles in the area. That's what loss of collagen looks like. Collagen is, as I mentioned, the most abundant protein. It is supportive, it gives the firmness to the skin. And environmental damage will accelerate the loss of collagen. Now, there are things that we can do to enhance collagen production, both topically and also internally and with lifestyle. It's never too late to improve the amount of collagen you have.
Thank you for that. So I have on the chat Attila from Cologne, welcome. And there's R.S. Mallory, that's the name I can read. So it's a statement more so than a question, but so they say, Dr. Samina, several years ago, I had bladder surgery, and my surgeon was, he gave them 5 incisions. healed in 5 days, and I was also healed internally as well. I've been taking laminine for 14 years and doubled up 1 month before and after the surgery. I also keep laminine at my kitchen sink because I use very sharp knives, and when I cut my finger, I wash it out, open a capsule, and sprinkle it on the cut and put on band-aid. 2 days later, it is healed with no scar. So very interesting that you have that amazing testimonial there. So, Dr. Haley, laminine is one of the products that we at Life Farm, we produce. And I am thinking that the reason he sees such a quick response literally is because it has the egg bioactive growth factor, and sprinkling that on that actually is like sprinkling amino acids, all your essential amino acids, marine proteins, plant proteins. So they are the building blocks, and they must be helping with the regeneration that is really amazing. So it's not even lamiderm apex that is being applied. It's basically just the powder of that capsule. So interesting.
I just want to add, I love that so much because as we age, our stem cells get lazy and they slow down how quickly they turn over. So when you're young, the stem cells at the base of your epidermis take about 28 days to get from the bottom layer to the top layer. And then as we get older, it can take 2 to 3 months. And it looks like dryness on the skin, but it's really because nothing's creating new skin cells and renewing from below. So that's why I love the growth factors, because it really helps stimulate those stem cells to produce fresh skin like you were younger.
Exactly. And I mean, skin is the largest organ in the body, almost like 22 square feet. And they say it weighs about 8 pounds. Many people don't think of skin as an organ at all. Whenever I'm having discussions with people, they just take it for granted. That's skin. That can't be an organ. But like Dr. Haley said, it's got the potential and inherent potential to regenerate. Imagine after every 28 days, you guys have a beautiful skin. It's like a regeneration system, your own. And it's just amazing. And thank God for that, because otherwise we'd be like so spotty and so like, because if it wasn't regenerating, we're always getting injuries and having acne or age spots, so many other things. So, Amiderm Apex aiding in the wound healing and wound repair, of course, boosting the wound healing are the bioactive growth factors, which it has. And it strengthens skin defense, so against environmental toxins and also any kind of infection. And hydration, so important. So, my question to you is, as a serum, what are the important ingredients that you feel would make a perfect serum?
Yeah, so as you mentioned, our skin is an organ that's basically protecting our inside of our body from an outside of the body. So if you look at a burn victim, they don't die from a burn, they die from dehydration or infection. So our skin keeps the moisture inside of our body and keeps us hydrated so everything can function and flow. And our body has the ability to deliver nutrients to all the organs, including our skin, and remove waste products, as well as prevent us from getting allergies and infection. So when I look at a product that has good ingredients that are going to enhance wound healing, which is basically what we're doing when we apply it to healthy skin, we're enhancing cell renewal, cell regeneration, we're supporting the skin. I just feel with wounds, you get more of the actives in because the skin barrier is compromised, but you're still getting benefits whether the skin is compromised or not. So growth factors are essential. We have to have growth factors to help support our body. The product I love the most right now, I'm falling in love with it, is niacinamide.
Mhm.
Niacinamide reduces inflammation. It helps support barrier function. It enhances wound healing. It helps prevent DNA damage. We're finding from sun exposure, and I live in sunny Arizona, so this is always a thing we're trying to do. It helps prevent the DNA damage we see from sun exposure, and it also helps to boost the immunity to help minimize the risks of skin cancers. And when we look at burns or severe wounds, those areas have a higher risk of getting cancer within them because of all the inflammation. So we want to be able to reduce the inflammation. And then anything that's going to hydrate the skin effectively and make a barrier so that, or a medium for the skin cells to heal over from the edges together. Those are the core things that I look for.
And so, when we look at Lamiderm Apex and in wound repair and healing, we also have the collagen, like I'd mentioned, type 1, type 2, and type 4. We have the egg bioactive growth factor from the fertilized avian egg extract. And the new formulation has vitamin C, which is in a very powerful way and more effective, more easily absorbed. We have our niacinamide, peptides, bakuchiol. And I think all these together are definitely going to help with the wound repair for sure, besides the aging. I mean, we've always talked about Lamiderm Apex for skin aging, improving the elastin, fibronectin, or fibrin, and collagen. We were not focusing on the wound repair, but today that is what we want to highlight. And also the importance of Lamidum Apex in reducing the appearance of age spots or fade them. And again, I'd like to encourage everybody to ask questions. We have Dr. Haley on board today, and let's ask her questions about skin.
Can I talk
So,
about age spots for a second?
yes, sure, definitely.
Yeah, so the way this works, I'm obviously infatuated with skin physiology and the causes of things. So as you had mentioned with the melanocytes, which are the cells that create pigmentation in the body, we all have the same amount. Some are more active than others. So when we're young and we get a tan, our melanocytes rev up and they make us evenly brown. And each melanocyte basically distributes pigmentation to about 24 keratinocytes on the top layer of the skin. This is what we're seeing. We don't see melanocytes on the skin. We see the keratinocytes. What happens as we get older, because everything's not functioning as well, is some melanocytes die off and they can't make pigmentation, and other ones try to compensate by becoming hyperactive. And that's what makes the skin look mottled and brown splotches with white areas where there's no tanning anymore. So if you look at your forearm, that's what the sun does to your skin over many years. If you look at the upper inner part of your arm, it looks like a baby's bottom. That's about 5 years. That's the natural age of your skin that is unaffected by sun.
Yes, I mean, the sun damage, I mean, I have to say that. And for people living in sunny areas all over the world and with minimal concept or understanding, especially in the third world countries, of using a sunblock, I think I see the damage that they actually have. And then I think it's like an irreversible damage unless you do some laser or cosmetic procedures in which you're trying to remove this, or those peelings or microdermabrasions and exosomes as well. But I really feel my professor of surgery used to tell us, he used to say, the skin is the best dressing. And I think it's on one of our like textbooks also. I forget like which textbook it was that it starts with that. It's there somewhere before you start the book. And it's true, especially when you see patients of burns. And I'm heartbroken when I see that. I used to work in pediatrics and we had a burn unit, and these little innocent children, just because of negligence from the parents' side, oh my God. And then, there was no way. I mean, who's going to afford skin grafting from that, paradigm? Like it's tough. And those children, many would lose their life because little babies have more surface area that they actually, exposed to that damage, and they don't have resilience. So many died because of water burn, especially in the winters. Do you see burn patients, Dr. Haley here?
I don't see that many. When I was attached to an academic center early in my career, about 15, 18 years ago, I would see the burn patients, but typically they go to the surgeons and the trauma units. We do see something called uh, TEN or Stevens-Johnson syndrome that looks like a burn, but it's usually a reaction to a medication that kind of makes all the skin slough off. It's just
Yes, yes.
very, very hard. And until you lose it, you don't realize how much we need our skin.
That is so true. So, again, this particular slide talking about the importance of how, collagen, elastin, and fibronectin are important. And this particular serum has the ability to stimulate it. Regeneration is happening. Those reduction in in this dark spots, which also happen during aging, and locking the moisture in, which is so important. So we'll talk a little about the most precious ingredient here, the egg bioactive factor. I'm not sure if you have experience with the growth factors which are taken from an animal source, because a lot of times serums in the market are using growth factors from plant sources or synthetic, which I know are not that beneficial as such. But what is your experience with growth factors?
Yeah, I mean, I've worked with a company in the past about 21 years ago that has a growth factor. It comes from circumcised male foreskin. And, we don't always know what's available in these growth factors. Some would argue some things, there's some exosomes in them and whatnot. And everyone has a preference as to what they want to apply to their skin. But the science behind growth factors is very, very good. It's just finding the right source and making sure it's in a formulation that's actually going to penetrate and do what it needs to do in the skin, like Lamiderm does.
Excellent. Yes. And so uh, we are very proud of this product because whoever I've spoken to, also many people, they had some injury and they applied it on that site. I personally had a lipoma, which I got removed, and my skin has a tendency to make keloids. And I'm always like, oh my God, a keloid. And if you can please explain to our, viewers, what is a keloid?
Absolutely. Okay, so when we heal, as we went through all the steps of healing, there's there's many different things sent out. One is TGF beta. And basically it gets overstimulated and it forms too much scar tissue. So there's three different types of scars. Basically, there's just your typical scar that tends to be atrophic or a little bit indented because it has different types of collagen, less collagen 3 than collagen 1 than your normal skin. And then there's a hypertrophic scar, which basically means it's a thickened scar. And this happens within the wound. So if you look at a surgery line, you'll see a surgical scar and it's just a little thicker, but it's in the surgical scar. Then there's a keloid that outgrows the boundaries of the actual scar. So not only does it get thick in the line of the scar, but it grows out almost like a mushroom head that grows out. And it's really, really challenging to treat. Under the microscope, the collagen is not horizontal with the tissue like it is in normal skin. It's very disorganized, and unfortunately cutting them out only makes it worse. So they're easier to prevent than to treat. So we always want to be intentional about really babying our wounds when they're in the earliest stage to prevent keloids and hypertrophic scars from forming. So using the right products and avoiding tension on the area. So certain areas like the jaw, the shoulders, the chest, where there's pulling and pushing and rotating, those areas keep getting pulled and they don't really quite know when to heal. And they're more of a tendency to form a hypertrophic scar as opposed to where someone might have a C-section or the Da Vinci where it's under less tension.
So I have my story first of that fibroid, that the lipoma, which I got removed, and I put Lamiderm for about 6 weeks, and the keloid, or that little thickening, it just kind of merged, it got disappeared, and my skin became fine. It just became a little more pink, which it wasn't before. It seemed like it had become really lighter in color, but also a little thinner. But my major thing was that it got rid of the keloid. But with the C-section, and I've had three C-sections. My husband and I, we have three boys, we have three kids in 4 years. So our stats are a bit sort of, it's crazy. But the first C-section I had, I have a keloid, okay? And I tell my surgeon that this was a different surgeon who did the surgery. So it's a big rubbery scar, a keloid. So when I went for my second surgery, I told my surgeon, while you are at it, because you're going to cut that again, can you make sure my keloid gets removed? And he did. But Dr. Haley, I never got a keloid after that. So is that a something that can happen? Because I thought I'll always get a keloid. I didn't.
Yeah, that's unusual. I mean, I feel like it's more of a young person's disease because there's more elasticity in the skin. So when we look at collagen, it's the major protein, it's the structure of the skin. The elastin in the tissue, in the dermis, is basically if you take your finger, your hand and you pull up, how quickly does it bounce back? If you take your under your eyes, how quickly does it bounce back? And that tells you how much, yeah, very nice. That's very good. So as our elasticity and our collagen deteriorate over time, we're going to be less likely to form keloids. I tend to see them in larger, more muscular men in their 20s and 30s, and in certain areas of the body, but it's really unusual to not get a keloid on the shoulder. So whatever you did it right.
Yes, and I'm excited that I didn't get them again. Now, I see a lot of men and women also doing intensive exercise and they are building their muscles, right? And a lot of times they're picking up weight, they're going really full throttle to get their aim is to get the six pack. But while they do that, I see some of them, their skin is going to stretch, and you'll see weird cellulitis like imprints. What is that?
Oh, those are stretch marks. So I mean, I exercise, but um, so that's stretch marks. So
And that's
typically
not good for somebody who actually like stretched it so much that now they've got that particular, imprint on their body, which
yes.
doesn't look good. I mean, that doesn't look good, the stretch marks. So can they ever go away, those stretch marks?
No, we do not have good treatments for stretch marks. There are some lasers, there's some things, but we're in dermatology, we're much better at removing things. We're better at removing pigmentation, removing hair, removing tattoos, removing blood vessels, uh, sanding down the skin. We're not so good at putting things back. So when the skin stretches too quickly, whether it's being pregnant, rapid growth spurt. I mean, I've done skin checks on probably 100,000 people over the last 24 years. And I often will see stretch marks on women around their hips and men around their lower back. And nobody even notices it, but I do because I see them again and again and again. And it's just from that growth spurt we had during our teenage years. And then if someone's lifting a lot of weights, maybe doing some extra hormones or something, and they expand their muscles too quickly, they will get stretch marks, which are tears in the elastic tissue. We don't have good ways of putting elastic tissue back in the skin. We could support it. We can help get rid of the redness over a year. But as far as making that skin go back to normal, we don't have good treatments for that. And I just wanted to make a comment about the
Oh,
scars because I I love scars because they are a story of someone's life. So anyone listening, don't be afraid of your scars because like I said, I examined like so many people, and whenever I ask about a scar, it's a story of their life, and the life that we live makes us who we are. And we should all feel proud that we can authentically show up as who we are today. And everyone has a scar, everyone has something that they might be self conscious about. And you're not alone. So don't be self conscious about it. It's your story.
so I usually call them war wounds. My father was in the army, and I've led a roller coaster life myself. And my husband always says, "You are a soldier's daughter," and so I do definitely, because I bruise easily, and all that stuff is also happening. But I do take pride in those. You're right, because it's like a story, whether it's that little chicken pox mark or the lipoma that was once there. And it's also showing, um, I guess, that resilience that you might develop also from having gone through some trauma or some kind of a problem, and then you're still around. So that's right. It's like a medal or a little feather in your cap. And I like what you just said. So that's something good to take home with us. So let's move on to our next slide. So this is an interesting experiment we did. And for all those who are, looking at this diagram right now, you have a bar diagram on the left side where you see on the X and Y axis is that the X axis is all about the number of hours, 24 hours, 48 hours, and also the one on the left, which is the Y axis, is showing the cell number. So if you notice in the control, versus the 1% egg extract. Here is an experiment where we basically took our bioactive egg extract, bioactive egg factor, growth factor, 1% of that, and we put it on human skin cells. And to see the activity, how does this egg extract or the fertilized egg extract you know m- cause any activity in the cells or not. And if you notice, 2 hours to 48 hours, you are seeing a lot of activity on the right side here on the slide, where you see the meshwork or the intricate mosaic like pattern which we do see with the collagen and elastin, and the way they are all getting all together to synergistically work to make this web and make your skin more stronger. So definitely the untreated cells are not showing that. And we also see that the increase in the number of cells is definitely a 45% increase after 48 hours. So versus the control. So, a lot of times when we use any ingredient, any product, we're also mindful of like who should use it and whether it's going to have any side effects. Is there any science to support all this? So, I want to ask Dr. Haley, first of all, uh, is it important to start taking care of your skin at a younger age? And if so, what is that age?
Well, it's never too young to start. We have a trend going on right now where people, teenagers in particular, are applying way too many products to their skin. I really like someone in their 20s to use a good quality sunscreen, definitely a vitamin C, retinol at night, or bakuchiol if they can't tolerate retinol. And then once you start hitting your 30s, that's when your genetics don't play as much of a role. And that's when your lifestyle matters more. And you really need to focus on the quote anti-aging or prejuvenation routine to help mitigate some of the accelerated aging patterns, right? And you had mentioned earlier that when somebody has a lot of sun damage, you might need in-office procedures. I would also argue or request a perception shift for everyone here that don't depend on the dermatologist to do procedures for you in the office. Like you may go to the dentist to have your teeth cleaned, but you still have to brush your teeth at home. And that's how I look at skincare. It's the slow compound effect over time. Ingredients like vitamin C can help brighten your skin and protect from further damage and give your skin a chance to repair, as well as vitamin C also helps to stimulate collagen formation. It's an essential cofactor in forming new collagen, and every day our skin is forming new collagen. Whereas the bakuchiol will also help renew and regenerate and repair cells. And then the growth factors, obviously, we deteriorate the amount of those we have over time. So having the egg bioactive growth factors is going to help your skin turn over and renew and actually reverse a little bit of sun damage. So it's never too late to start. I like someone to start in their 30s for sure. But if you're new to anything and you haven't really used much over time, even if you're 50, you're going to see results. Give everything you try at least 3 months to start working. It takes 3 months to stimulate new collagen formation as a general rule. Everybody's a little bit different, obviously.
What about people who are drinking collagen? What are your thoughts on that?
So the science is really good. You want to look for collagen peptides anywhere from 10 grams to 30 grams a day, preferably with hyaluronic acid and vitamin C as well, because those are going to help improve the collagen. And the studies that are out there, we're not taking biopsies of the skin where we could actually look under the microscope at the collagen, but in evaluation, we're seeing improved skin barrier, right? We're seeing reduction of fine lines and wrinkles and improved hydration of skin. So it's a low cost for people. There's one product called Verisol, which is a patented collagen that I tend to have the most science supported by it, but I find benefits with most collagen peptides. I like them to be derived from as many collagen sources as possible, depending on your diet, obviously.
So it doesn't have to be all plant-based. It can also come from, an animal source. You are okay with that, or a mixture
Yeah.
of the. Okay.
Yeah, I like a mixture of marine and bovine and chicken and, I like a mixture. I do have some patients that are, they'll only do the marine form, and we are seeing improvement with just the marine form as well.
Now, is it true that taking hyaluronic acid in a liquid form or otherwise for people with blood pressure might not be a good idea?
Yeah, I mean, there's not really enough science behind this, to be honest with you. So it's usually added in small amounts to a formulation with the collagen. I wouldn't necessarily look to take it separately because there's not a ton of science behind HA. Have you seen any?
I have been told that taking a liquid hyaluronic acid, because a lot of people take it for joint health, you
Mhm.
know, if you're suffering from arthritis or you've got some other, bone issues or joint issues, people have always loved taking hyaluronic acid and chondroitin sulfate, right? So what I read a little about was that if you do suffer from blood pressure, it is probably not recommended, and just to be kind of wary and not really go for it. So that creates a little doubt in your mind, and
Right?
I personally am one of those cautious practitioners. I've always felt that, like I said, less is more. Let's not go full throttle with too much. Take it slowly, because you're able to, kind of, once you give too much of anything, I really feel then the processes become irreversible, and it's difficult, more difficult to then handle a case versus if you took those baby steps to slowly see, are they doing okay with it, starting with small doses and, then moving on. So I thought I would ask you if you have any experience with that.
Yeah, I don't think my patients are taking that high of a dose because they're taking what's in the collagen. So I'm curious as to the mechanism of action for that.
Mm.
Definitely something I want to dive into deeper. But on that note, I also see the same with skincare. People will start too many products at once. So we
Mm.
want one good product. It's not about more is better because there's science, like look at the Lamiderm product, for instance. There's science on that product, but is there science with Lamiderm and 6 other products on the skin? There's not. So we don't
Yeah.
know how all of these things interact. So you want to start low and go slow when you're adding a new skincare routine. I don't like people to add new products
Yes.
more than every 6 weeks. Give
Oh,
good
I
product.
think people are addicted sometimes, to this. And I've seen them with bags and bags of multivitamins because somebody told them zinc is good also and magnesium. And I'm not trying to say they are not. It's just that you have a body with the liver and kidney, and you can't put so much brunt on them. Taking these synthetic multivitamins, especially which are not natural, sometimes not even tested, and they look like cement bricks. And I feel, oh my God, how will this body digest that? It's going to take its toll. And so a lot of times you'd say it's an expensive stool. That's all I can say. It goes in and it gets out. That's all. You can psychologically feel that you benefited from it, but it's not so. And then again, I was reading your bio, and you're somebody who also emphasizes on holistic and natural. So I wanted to get your thoughts on what if I was to do something totally natural? I don't have access to expensive products, but I'm somebody who wants to have a great skin. What are the things that you can tell me which are probably easy to manage that way?
Drink plenty of water so your urine is clear because that's going to help good lymphatic flow, which is going to, and good blood flow to deliver all the nutrients and remove all the toxins from just our metabolism every day. If you can't afford a sunscreen, wear a hat every time you go outside to the high real estate areas, the very high valued areas of the face, the neck, the chest, the back of the hands that are going to show aging. I don't typically wear sunscreen anywhere else because I do think the sun is a vital energy force. We need to have it in our eyes first thing in the morning at sunrise to set our clock for the day and sunset. Those are the great times to get outside and get a little exposure to the large areas of your body to produce vitamin D and all the other benefits it gets for your skin. Avoid alcohol. No nutritional benefit, no benefit for your skin, no benefit for your brain. Avoid sugar and processed foods. Sugar forms advanced glycation end products, which are AGEs, which basically make the collagen stiff and rigid. And if you can find photos online, it looks like hatch marks on the skin, basically, when the skin is rigid. The collagen is very disorganized and it's not going to bounce back and it's not going to hold its structure. Those are really, really important things. And then I want you to start looking at food as messages. So is this food have the most nutritional value, or this food have the most nutritional value? Because when I was in medical school, we were taught that nutrition did not play a role in health. And it didn't make any sense to me because I studied nutrition undergrad. I said, okay, let me get this straight. We take medicine, and the medicine magically knows where it's going to go in the body and fix you, but the food doesn't know anything. So the food we choose to eat every day is going to bring us closer or further from where we want to go. So in 1 year's time, eating the cake doesn't matter. Enjoy it. But if you're having it every day, the compound effect is going to play a big thing. So I really look at the compound effect. If I do 10 minutes of exercise a day, that's over 50 hours a year. If I get sun to my face 10 minutes a day, that's going to be 50 hours a year. No one's going to the beach for 50 hours without wearing sunscreen. The same is true with everything we do. Little things make a big difference. And the most important is community and connecting with people that replenish your energy, because we're finding that oxytocin, having high oxytocin levels, the bonding chemical, it actually helps support collagen production. So most of these things are free. And then one other tip to get rid of zombie cells and the dead cells in our body that basically interfere with healthy cell production and they accumulate over time. They're called senescent cells. Fasting. I can't get past 24 hours, but if those of you are strong and you can fast and your doctor says okay to fast, if you could fast for 48 to 72 hours, fasting gets rid of these sort of dead zombie cells. And all of these things are low cost, just like getting good sleep, breath work, meditation. I love Dr. Andrew Weil's 4-7-8 breath. Do it all the time in the grocery line, at the stop sign. All of these things are very low hanging fruit and easy to do.
I think the most common question asked is how many glasses of water? Everybody has a different answer to that one. What is yours?
I live in Arizona. It's very dry here. I exercise quite a bit and I don't calculate. Don't drink out of plastic either. Avoid plastic and avoid as many chemicals as possible, because the more our bodies are exposed to chemicals, the liver gets busy, the kidneys get busy, our detoxification organs get busy, and they can't metabolize our hormones and all the other things they need to do. So I carry around a stainless steel water bottle. I'm clumsy, so I don't do glass. And I just drink water all the time. And if my urine isn't clear, then I drink a little bit more. And I try to add minerals or fulvic acid and humic acid, which we should be getting from our soil, but we don't because of our farming practices in the United States. Some of you are around the world. You gratefully have more access to healthier foods than we do here.
So I found a lot of content here, from you and points on how we can improve our skin. So I have an aunt, and she married an older guy, and she asked me, Samina, what can I do to improve my skin? And this was some years ago, and I said, oh, auntie. You know, the three things important for a good skin is you must drink a lot of water, having sex is
Yep.
really great for the skin. And auntie, the third thing is good sleep. So my aunt goes, well, this guy I've married, he's kind of older, so because of that, she goes, he doesn't have that much sex with me, so I can't even sleep that well. Are you suggesting that I just keep drinking water? So I'll never forget that. I think, but today, I think with time and all, we have a lot of more things we can do for the skin, which is amazing. So, so we have a question for you from Inga. Can new serum improve skin texture after the radiation treatment? So, she's asking about Lamiderm Apex, but you know what all the ingredients are. So, Dr. Haley, what do you think after radiation treatment, something like Lamiderm Apex, how could it help?
Right. Yeah. Well, First of all, I hope you're doing well with your treatment. And I don't think we have any studies on it. Do you have any studies on it yet?
I think not after radiation treatment as such, but we just know that our ingredients have worked very well for people who've had surgical experiences like that, but nothing specific to radiation.
So, as a dermatologist, I do pattern recognition for a living. And we often take medications that are meant for one indication, and we like to see how we can utilize it in different areas. So, understanding the ingredients and the actives in Lamiderm. And if you look at radiation dermatitis, it's similar to even what I'm experiencing with this burn or other wounds. And we want to enhance wound healing and reduce inflammation. So I'd certainly give it a try. I would most certainly give it a try if it was me.
Yes, and we have, like the slide says, a lot of times we've using it with minor wounds, scars, and irritation. And I'm thinking radiation will obviously cause inflammation. That's the first thing it'll cause. So anything to reduce that, the heat generated wounds also will definitely help. And then we know that there are no side effects. All the ingredients in Lamidum Apex are really good for you, whether it's niacinamide, bakuchiol, peptides, and the egg. Bioactive factor. So you've nothing to lose. And I really feel, before trying any product, you could use it in a place like here and then try to see if there's any sensitivity before you really apply it everywhere. Yeah, good luck with everything. And we hope you are doing well with your treatments for sure, Inga. All our prayers for you. So, how to use a particular product? Like for this particular product, the Lamiderm Apex, we recommend that generally applying it morning, night, or two times after cleansing. But for wounds, to apply it to the area twice daily again, but gently. And then it's safe for all skin types and has been used. It's hypoallergenic. It's got no toxicity. There's been third-party testing as well. And I think all those things point to a safe product. I do want to ask Dr. Haley, how can I devise a nice skin cleansing routine for myself, and where do I put the serum if I was to have a daily routine, morning and evening?
Absolutely. So I wanted to comment on cleansing because I think a lot of people do it wrong. And before I want people to add things into their skincare regimen, I want you to make sure that you're doing the right thing or often remove things, right? So I find that people cleanse too harshly or they're not cleansing properly. So the right type of cleanser is going to basically remove your dirt and remove your makeup and then not make your skin feel tight. You don't want to strip your skin barrier. So for Inga, when with the radiation dermatitis, you don't want to over cleanse the area because that's going to compromise the skin barrier even more. So typically when I have patients with dry skin on their body, I only want them to use soap under their arms, groin, and feet because the rest of our body doesn't need that much soap. We don't produce scent in other areas, and we're stripping our natural skin barrier. So for your face, you do want to cleanse every morning. Why in the morning, right? We just slept because our skin is one of our major detox organs. So overnight when we're sleeping, our body is detoxifying and removing heavy metals and metabolic waste through our pores. So you will have dirt on your face in the morning. And when you're applying a high quality serum, you have to remove the dirt and the debris and the environmental insults during the day and also overnight in order for the serum to penetrate and get to where it needs to be in the skin. So basically cleansing in the morning and at night so that your skin does not feel tight or burning or irritated, and then applying the serum. If you're dry, now you put a moisturizer over the serum. Something with ceramides or hyaluronic acid is nice. I personally didn't need to apply any moisturizer after the Lamiderm in the morning today. And then a sunscreen, SPF 30 or higher with zinc oxide. And if someone has pigmentation issues, I like a tinted sunscreen because a tinted sunscreen has iron oxide that helps prevent pigmentation from the blue light coming off of the screens that we're exposed to all the time during the day. And then at night, cleanse, apply the Lamiderm, treat your face, your neck, your chest as one unit. We want this whole area to age the same. Whatever's left in your hands, sweep the back of your hands, because these are the areas that show aging over time. And then at night, moisturizer. You really want to hydrate at night to your eyes and your face, your neck and your chest, because we have increased transepidermal water loss. We lose more water at night. So that's when we want to really make sure we pack on the hydration.
So that's amazing, what we can do. And, skin never stops in fascinating me with the way and how much work it does. The fact that 10% of your blood supply is basically is being held by the skin. And then the thermostat that, whenever it's so hot, it starts sweating to make you feel cool. It's like your guardian angel. And then when you feel very, sort of, when the temperature is kind of cooling down or whatever, because of sweating, you're good. And then how, like, if you walk into a very cold place, let's say you go out in winter, anywhere you are, and if it's snowing, the blood vessels, the tendency to contract so that you hold the heat inside. It's like having a thermostat, that you, which is working to, just to keep you warm or hot whenever, that is required. What an intelligent skin system, where it sheds it, you're shedding your skin cells only because you have to get rid of the bad ones, and then you regenerate new ones. So you are actually restoring your health all daily. Regeneration, preservation, protection. God knows how many functions this skin does. But we sometimes don't take good care of it. And it's so important to pamper yourself. I tell people sometimes it's not easy to walk into a massage place every day, or to buy all these very expensive products. A simple act like taking a small washcloth and putting it under cold water. I've seen, not hot, but cold. And you just kind of put it at the back of your neck where the cervical spine is. It's so relaxing, so soothing. If people don't like the wet, cold towel, you can do the hot one. But by the way, for people to stay youthful, I read somewhere splashing cold water on your face does miracles. And you can really have nice sort of young skin, which is amazing. No botox required. I read somewhere 100 splashes of ice cold water on the face is an anti-aging maneuver. I've been very interested in skincare since a young kid, always getting facials and fascinated by new products, which I like to try also. But it's just a passion. And so today's webinar was definitely very useful for me, because I learned so much from you, Dr. Haley. Thank you. Thank you so much for taking out time. And you realize, like today I did that. There's always something new you'll find out in your life, right? And it's your experience of over 20 years. It's been very beneficial for us. But tell me a story or a particular observation which you feel will really be fascinating for us here, which concerns skin.
Sure. Yeah, there's so many things you just touched on. It's funny because when I woke up this morning, I was splashing cool water in my face, and I was thinking that as well. I wonder if this is benefiting me. I think it stimulates the lymphatics to start flowing and help get rid of puffy eyes. I think also with the cold plunges, there's quite a bit of science that it boosts dopamine in our mood. So, cold showers and cold baths can definitely benefit not your skin so much, but your overall health. And I think if you have a healthy mental state, you're more apt to make good decisions during the day and have good relationships and be motivated at work. I do want to go back to blood flow. So I'm a huge proponent of exercise and moving. It doesn't have to be going to the gym. It could be walking your dog, walking with friends, because connection is the ultimate longevity booster. So uh, really, you want to move your body as much as you can during the day. So, whether you're, just bending down and squatting and doing different activities, lifting heavy things, doing your own manual labor, because Having a healthy blood supply is essential to beautiful skin because you eat healthy foods that are your foods are messages to turn on the healthy genes, turn off the unhealthy genes. Your skin is representing all of your organs. If your skin is inflamed, there's a clue something else is going on deep below, usually in your gut. And your blood flow needs to bring the oxygen and the nutrients to your skin. So if you don't have healthy blood flow, you're not even going to get the nutrients there. Your blood flow also needs to remove all the waste products because our metabolism is going all day. It has waste products and it has to remove those waste products. So really think of the whole system as working continuously, and your skin is representing your internal health. And there's things you can do to nourish your skin from the outside in, and there's things you could do to nourish your skin from the inside out. And give yourself grace, do the best you can. It's little things moving you in the right direction over time. And that's what I'm here for people, is to walk the journey, share my knowledge, and help people empower themselves to make good decisions because there is so much bad information out there.
So there's an interesting fact, and I wanted to find out from you if it is a true fact. They say that your skin can smell. Research shows that skin cells have scent receptors that can detect odors, which may even help in wound healing.
I don't know about that. I'm going to have to research that. I know there are photoreceptors on the skin. So our skin has light receptors. So at night, it's essential to be in a very dark room and covered with the blankets, because if not, your melatonin is not going to be boosted and you're not going to be in repair and regenerative mode. I don't know about the smell though. That's so interesting because I have a really strong sense of smell. And now I'm wondering, has it been my skin smelling it this whole time?
Me too, because a lot of times I smell more than others, and I'm thinking, hey, we have the same nose, all of us anatomically, and we have those receptors which are for smell. Why are some people more receptive to smelling a lot more than others? So we need to do some study on this one, you and I, and then we'll get together. I'll probably come to Arizona and we can discuss that over maybe a nice cool drink.
Yes, Dr. Samina, thank you for teaching that to me. I will be doing some research on it because that's how I am. So very fascinating.
Yes, yes, for sure. Oh, okay. We have some success stories here.
Nice.
So, can we go to the previous one,
I
Leah?
wanted This one is so beautiful because you could see the post-inflammatory hyper.
Yes, yes, yes.
Yes, I love it.
This is Emilia, and she had this, these different marks on her face there. And over a period of time, she basically has an appearance which is better. I mean, she looks amazing. It's a brighter complexion. She has, there's barely any scars there, and she applied Lamidum Apex, and for her, it was life changing. And I really feel that must be so amazing because we get so insecure and so conscious when we have even a small little zit on our face. Can we go to the previous one? I think that particular slide also shows a little about wound healing and how when you apply something to a wound, you see the difference, how it's healing from day zero to about seventh to 10th day, you see the repair. So beautiful. That's great. And we can see that it works. And I think, Dr. Haley, you mentioned, I was always thinking that we should not apply a serum or a healing serum to a wound when it's open, but you said it's fine to do so. It's actually a good thing to do it there.
Yeah, we want to keep the skin cells bathed so the cells from the edges can heal over and there's a medium for things to grow. We do not want a scab to form. Now, if it looks white and macerated, it's too moist. So really, when you get out of the shower or the bath, let it dry for about an hour and then go ahead and apply your wound care.
Know that when you have a wound like that, you should let it air dry and not put those band-aids. A lot of times I get confused. Should we cover it? Should we not cover it? Which wound should be covered? Which shouldn't be?
Yeah, I don't love the glue on the Band-Aids because I see so many reactions to it. But when you're putting a barrier on a wound, you often have to keep it covered so it doesn't get wiped off, right? So it's just a practical aspect of it. There's something called Tegaderm, which is it covers the whole area and it tends to be a little bit less irritating. So it just depends on your clothing and things like that. I do want to note though, with a wound, we talked about blood supply. The further your wound is from your heart, the longer it will take to heal. because of the blood flow is going to basically, if you imagine you have your heart, it pumps out the fresh oxygenated blood. If you have a wound on your face, it's going to heal quicker because it's getting the oxygenated blood quicker than your ankle or even your knee, because by the time the blood gets there, all the other cells sucked up the nutrients in the oxygen, and it's devoid of the best nutrients and the most oxygen by the time it gets to the leg. So a leg could take 2 to 3 weeks to heal, whereas a face can take 7 days to heal.
That makes so much sense. And then I think another fact to remember is delayed wound healing is not good. If you are getting that, then you must check your sugar levels. And because a lot of diabetic patients have delayed wound healing and they don't realize it, that it's that's a sign too. So let's move on. I think this was probably the end of our webinar as such. And we are so grateful to you once again. Thank you, lady. Thank you for sparing time and for guiding us so well.
I had so much fun talking to you, and I hope we answered everyone's questions. And yeah, always
Yeah.
here for
So,
you.
yeah. Any message to the people on this webinar? Anything you'd like to say?
Just wish you the best health and just know that you have more control over it than you realize.
And I'd like to also mention my training in Ayurveda, taught me that you must love yourself always. And that beauty is not just outer beauty, it's inner beauty, it's eternal beauty. Everyone is beautiful, all of you, whoever is right here, your friends, your children, and make everybody feel good. Don't criticize, don't complain, don't demean people, don't, not the body shame, nothing like that. Accept people for the way they are. Everybody has beauty. Maybe we are not really seeing it. We need to shine and clean our lenses, that's all. So appreciation is so important, and loving yourself is the first step. We must love ourselves. You must put a little sign in your bathroom when you come out of the shower, whatever it says, I look amazing. And give yourself those affirmations. It's so important for your own self esteem and confidence as well. You know, I know when you look good, you feel good, but you should always feel good. Just be happy.
I agree. And I mean, I would not be a good Dr. Samina and you would not be a good Dr. Haley, right? Like, I'm good at being myself. You're good at being yourself. And everyone listening, you're good at being yourself. So bring out the inner radiance in yourself. And that's from being aligned and knowing who you are and showing up authentically and unapologetically as you are. And then you will glow. Who cares about two-dimensional beauty? We care about how you radiate when you walk in a room that's contagious. It's a contagious attraction, and that's what matters, and that's the future.
That is so true. And I think we are missing out on a lot of real, authentic beauty. And I really personally am not going to tread on that direction of all the fake stuff. And I know a lot is available, but we would like to stay closer to nature. And I think that's important. Thank you, everyone who joined us. And I'd like to end by saying stay happy, stay healthy, and stay blessed. Thank you so much.
Bye, everyone.